Hi, my name is Randy Sung. I'm the Surgical Director of Kidney Transplantation at Michigan Medicine, and I'm going to give you an overview of living donation to start this program. So first off, why living donation? Well, the main reason is because there's simply not enough deceased donor organs for everyone that needs it. Unfortunately, you can't use pigs or sheep, although people are studying that possibility. There's no ability to clone organs, although there is definitely a lot of research on that. Um, and there's no artificial organs. You can't print them on a 3D printer like you can on for some other medical or anatomic structures. Um, so all of these modalities could come about and change the course of transplantation and eliminate the need for living donation, but right now they're all still experimental. The outcomes of living donor transplants are better than those from deceased donor transplants, so that's an advantage to the recipient. But as importantly, generally speaking, waiting times for deceased donor kidney transplants are on the order of years, and with a living donor, you don't have to wait, which not only is preferable to the person who needs the transplant, but they are also a little bit healthier when they receive the transplant. So as I mentioned, living donor kidneys last longer. A living donor transplant on average will projected to last about 25 years if done now, where compared to 15 years for a deceased donor kidney transplant. Now, these are averages, and the actual survival of transplants in a given patient is a lot more variable. But as you can see, overall, living donor kidneys will last a lot longer than deceased donor kidneys. Living donation is very common. This graph shows the number of kidney transplants from living donors and deceased donors over time. And as you can see, roughly 1/3 of transplants are from living donors. So it is, while we would like it to be more, it is certainly not experimental. It's very, very well established. Now, sometimes people think that only blood relatives can be living donors. And while people that are related to the recipient often are living donors, it is absolutely not the case that you have to be blood related. As you can see here, people that are not related can be living donors, and that number is increasing a little bit. And so these can be spouses or partners. These can be friends. They can be people in local communities like churches or a coworker. In addition, there is not an insubstantial percentage of donors who don't know the recipient and just want to donate to somebody to do a good thing. So why don't more people donate? Why is there a need? A lot of it is simply unfamiliarity with donation and the need for transplantation. People may not know somebody who needs a transplant and therefore not be aware of the need. People aren't necessarily educated about living donation, although there are a lot of efforts to do that. There's a natural fear of donation simply because it's major surgery, and most donors are healthy. They probably haven't had major surgery before, so there's a lot of unknown. Sometimes resources get into the way. People simply can't take the time away from either caring for people in their household, from work, et cetera, and that can sometimes get in the way of somebody's ability to donate. Probably the most important reason is just people not being aware of the need, and this may be in general not being aware that people need kidney transplants, but maybe even not being aware that somebody that they know or may even be close to needs a kidney transplant. This is a picture of the founder of the Michigan Transplant Center, Dr. Jeremiah Turcotte, and the first Michigan Medicine kidney transplant recipients from a living donor. These were identical twins. And at that time, as you can see in 1964, that was the only way a transplant could happen because there was really no anti-rejection medication. And so this was a successful transplant that has lasted to this day. And this is a picture of the donor and recipient with Dr. Turcotte at a 50-year anniversary celebration of Michigan transplant. Now this is MACI. Macy was a living donor to her cousin who needed a transplant. Macy was actually a lawyer, but she got very, very interested in living donation and in transplantation as a result of her journey from being a living donor. He was actually a newscaster in the Midwest, and he was having trouble executing the responsibilities of his job because of his kidney failure, and his transplant allowed him to get back to essentially the life he had before kidney failure got in the way. And this whole experience was so impactful to Macy that she wound up changing careers. She got a PhD in epidemiology and now works for a group that does transplant research. And she also is very, very active in advocacy for living donors in the national system. Now I want to talk a little bit about pair donation. Most living donation is direct from a donor to their intended recipient, but sometimes a donor and recipient are not compatible with each other. And in that case, a transplant can still happen. There are several different systems whereby donors and recipients that are incompatible can go into a pool where they can find essentially matches of donors and recipients that they are compatible with. In the simplest version of this, the donor and recipients simply swap, so that in this example, donor 1 donates to recipient 2, and donor 2 donates to recipient 1, and each person that wanted to donate donates, each person that needed a transplant got one, just in a different way. So this is a very important way by which people can get a living donor transplant. And generally speaking, if a donor and recipient are not compatible, we highly recommend that they enter into their donation. There are some situations where even if the donor and recipient are compatible, the pair donation system may allow the recipient to get a kidney that might work a little better or last a little bit longer. I mentioned that there are people who want to donate but don't have anybody in mind. These donors can be put into the pair donation system to actually help facilitate a number of transplants. In this type of mechanism, what we call non-directed donor donates to a recipient in the pair donor pool, and then their donor donates to another recipient, and they essentially kind of pay it forward. So in this way, somebody who's a non-directed donor who's looking to help somebody can actually help a number of different people get transplants. So in the course of this program, we're going to be talking about finding a kidney donor and about what's involved in being a kidney donor. And I'll just preface part of the program by saying there are many different approaches to identifying a living kidney donor, and you should find the approach that is right for you. People have different comfort levels with wanting to directly ask people about being a kidney donor. Some people utilize friends or family to help do the asking, and some people go so far as to put it out on billboards or even on social media. This is becoming increasingly utilized, and it can be an effective way to identify a living donor. And you'll find that there's a whole spectrum of ways to find a living donor, and you'll be hearing more about that today. Thank you.